Liberia faces widespread health problems, including Ebola, endemic malaria, malnutrition, widespread mental health problems and a low level of public health awareness. Liberia has 5,000 full-time or part-time health workers, and 51 Liberian doctors to cater to a population of 3.8 million, according to the 2006 health survey. That is equivalent to about 76,000 civilians being attended to by one doctor. Most of the hospitals, clinics, and equipment were destroyed due to its 14 years of civil conflict from 1989 all the way until 2003. The strengthening of the health sector faced financial problems. The government used only 16.8% of the total health expenditure in the country. Liberia has heavily relied on the international community for health infrastructure and aid. International relief organizations assisted the government to rebuild health facilities and provide essential health care for its citizens. The World Health Organization donated equipment and helped provide and assist in vaccinating the population to prevent the spreading of many communicable disease. The Global Alliance for Vaccines and Immunisation funded $160 million to improve the healthcare system and increase the quality of immunization services in Liberia. Copyright Vaccines Sans Frontières, an international medical humanitarian organization, helped Liberia by operating free hospitals right after the Civil War and treated more than 20,000 women and children per year. As part of a wider regional Ebola outbreak in 2014, Liberia had suffered 779 deaths from Ebola as of September 22, 2014. Ebola was first reported in Liberia and Lofa and Nimba counties in late March. A considerable amount of the population suffers from mental illnesses, or were mentally or physically traumatized, due to 14 years of intense civil conflict. A study by the American Medical Association in 2008 had showed that a staggering 40% of adults had shown symptoms of major depressive disorders. 44% of adults also had symptoms of PTSD, or post-traumatic stress disorder. There was only one psychiatrist in the country at the time. It is impossible for one psychiatrist to be able to tend to over 1 million victims. In addition, E.S. Grant Mental Health Hospital was the only hospital for patients with mental illness. The hospital only had 80 beds, which left almost all those with traumatization unattended for. HIV/AIDS is one of the biggest diseases that has affected and is affecting Liberia to date. At any given time 33,000 are living with HIV in Liberia. This is a terrible statistic as due to Liberia's incapability to treat this disease only about 1.2% of those affected survives from the devastating disease. In December 2009, Integrated Regional Information Networks News reported that 45% of Liberian children suffer from varying forms of malnutrition. A nutrition advisor from UNICEF told ERN that malnutrition results in learning deficiencies, which will affect the economy in the future. This results in a vicious cycle, as the country continuously grows poorer and poorer as a result of increasing malnutrition. UNICEF reports that, if the status of Liberia's health does not get better, the country will lose $130 million in economic development within the coming 8 years. UNICEF and non-governmental organizations, or NGOs, are working with the Ministry of Health to increase the awareness of malnutrition and make it a top priority of the country. Providing nutrition services is a major priority for the government, and it forms an important part of the national health policy. In 2008, the Health Ministry developed a nutrition policy, which became a good start from the CVCRS promise. With this new policy, the Health Ministry aims to reduce the 39% chronic malnutrition rate by 1/3 by 2011, and fix one of the greatest issues of Liberia,